Hello and welcome to our broadcast. I'm your host, Grace Nunez. I'm a communication manager at Providence for Washington, the Montana region. As a reminder, the information provided during this event is for educational purposes only. It is not intended, nor is it implied, to be a substitute for professional medical advice. If you have any questions regarding medical conditions or treatment plans, please consult your physician. All right, well, let's begin. Joining me today for this live event is Dr. Mike Barsotti. He's the Chief Administration Officer at Providence Sacred Heart Medical Center. Thanks for being here, Doctor. Appreciate it. To get us started, can you tell us a bit about what you do and your role with Providence?
Yeah, thank you. And thanks for having me. My name is Michael Barsotti. I am a physician, and I happen to currently have the role of the Chief Administrator for Sacred Heart Children's Hospital here in Spokane. I also happen to be the president of the Washington chapter of the American Academy of Pediatrics. By training, my background is in pediatrics, but I practiced in neonatology or with preterm babies for most of my career.
Great. Flu season, that's what we're talking about today, and I think it's on everybody's mind, especially flu and kids, and all about that. So our first question is, flu season last year was really mild, probably because kids were doing school from home and people were masking. And can we expect that this year?
Probably not. So last year there was a decreased flu season, we think because of all the strategies we put into place to mitigate COVID. So the social distancing, the masking, in fact, with kids going to school from home, so the virtual learning, that all decreased activity of kids and really decreased the flu season to minimal amounts last year. In fact, we saw early in the season numbers starting to rise, and as we implemented the changes for COVID, you saw the numbers drop back down quickly. That's going to be different this year, right? Because this year kids are in school, they are being asked to mask, so there'll be some protection from that. But truly, by them being together more, we should see a more robust flu season this year.
All right. And is the flu really that dangerous for kids?
So dangerous is an interesting word. Yes, they get sick from it. Yes, in normal years, anywhere from 30 to 40% of every single child school age will get the flu. So it's a big exposure. Yes, kids can actually get hospitalized and die from the flu, but the numbers are not huge. The highest risk population for kids would be the under 5-year-olds, but really specifically the under 2-year-olds. They're at the highest risk of being admitted and have the highest mortality rate. Though even in that age group, the mortality rate is not very high, but it does exist.
And do they get a milder form of the flu, similar to what we typically have been seeing with COVID?
No, so that was one of the things we talked about early in the COVID season, is that we noticed there was a difference between the flu and COVID in terms of the type of disease that was obtained, right? COVID, the high-risk population were really the elderly, and kids were really a low-risk population when it came to COVID. They got less severe diseases in COVID compared to the adults. Flu, that's not true. There's two populations at risk for severe disease in the flu. Again, the elderly population, but now with the flu, kids, especially under age 5, are at very high risk to have significant disease.
Right, makes sense. And then, speaking of symptoms, how long does a fever typically last for kids with the flu?
Yeah, it's interesting. I tried to look up specifically fever. We all know with the flu that usually you have sort of the big symptoms of fevers, the achiness, the really feeling tired for about the first 3 days. So that would be my answer for the flu, for the fever. I couldn't find out specifically when the fever breaks, but if certainly you continue to have a fever for more than 4 days, I would contact your pediatrician again.
All right, great. And what kinds of things can people do to care for their kids at home when they have the flu?
Yeah, I think it's keep kids well hydrated, keep them drinking, very important with the flu, and then rest. You get them to rest. And then you also, by resting, I don't want to use the word isolate, but the spread of the flu it's pretty contagious. And so you want to keep them away from people. You want to minimize their ability to spread to other people. but really Tylenol, not aspirin, but Tylenol for fever and aches and pains, fluid and hydration, and rest.
And going off of having rest and keeping them away from others, how long do kids need to stay home from school or other activities if they've had the flu?
That is a really good question. So the hard part, I'm going to answer it backwards, and I apologize, but you are contagious with the flu about 24 hours prior to you having any symptoms. So that's the hard part. You don't know you're sick and you could be spreading the flu. At about a week after your first symptom, the ability to spread it is almost gone. Very few kids spread anything. So yeah, at least a week, 7 days.
Okay. And then talking more about timelines, when should parents be concerned enough to take their kids to the doctor or the hospital? And then what are some of those serious complications that could happen with kids and the flu?
Okay. So the typical flu, what you're expecting to see your kid go through is a lot like what you're going to go through, right? So it's a respiratory tract infection. So they could have breathing, congested breathing, cough, obviously the fever, the aches, the malaise. Those are the common things you're going to see. Those should all begin fading, not gone, but fading about 3 days into it. So 3 to 4 days into it, if their symptoms are not getting better, you need to go see your doctor. If your child cannot take any fluids and liquids and their urine output decreases, you need to go see your doctor. And if the fever lasts more than 4 to 5 days, you should go back and see your doctor.
Okay, great. And then how long has the flu shot been recommended for children ages 6 months and older?
And let me go back. I'm sorry. When we talked about symptoms, I just want to be clear. The cough is one symptom that can last longer than 3 or 4 days. So a lot of times the cough with the flu will go on. So I just wanted to point that out.
Okay, so that lingering cough, even if the kid doesn't feel super sick anymore, they still have that lingering cough, right?
So I just wanted to make that point clear.
Okay.
Yeah, so actually the whole flu vaccine originated after the 1918 pandemic, right? But really we didn't start recommending flu shots until the 50s, and I think 1960 was the first time they recommended adults. And as of 2010, we recommended annual flu shots for anybody over 6 months old.
All right, so that's pretty recent, actually, 2010.
Well, I like to think that, but we're at least that's 11 years of history. So.
Yeah, that's true. It's all blending together these days, right? All right, so how contagious is the flu compared to COVID and other communicable diseases?
So the way the flu is very contagious, and it gets spread by contact with sort of your fluids. So when you cough, you can aerosolize particles. If you sneeze and stuff stays on the counter, someone else touches that counter, they can get the flu. So it's more by contact or being in contact with people that have the flu, but it's fairly contagious, which really speaks to why I started by saying that up to 40% of all kids each year get the flu.
Yeah, that's a lot. We have a question from the chat, so you're encouraged if you have your own questions to put them in the chat and we'll get to them. So we have one that says, if my child's school has a flu outbreak, should I keep my child home?
Oh, that's a very good question. So when you look at the kids that get sick from the flu, 80% of them are kids who have not been vaccinated against the flu. So I think if your kid got vaccinated, which I strongly recommend, but if your kiddo gets vaccinated, then no, you should not have to keep them home from school. If your kid has risk factors, things like asthma, things like immune compromise, then you might want to consider keeping them home from school. There's a large outbreak of the flu at the school.
Okay, makes sense. And going back to vaccines, lots of parents are nervous about vaccinating their children for COVID when it becomes available for kids under 12. And when it comes to the flu, should they have similar concerns for that flu shot, and why or why not?
Yeah, I don't know how to talk about similar concerns. I think whether we're talking COVID or we're talking the flu, I get that parents are out there trying hard to make the best decision for their kids and for their family. both from a social and both from a medical point of view. So I get that that's going on, and how people interpret data, interpret what's out there, is what gives us the discussion that we always have about whether or not the flu vaccine is not the mRNA vaccine that the COVID vaccine is. The flu vaccine we've also had for greater than 6 months old. We've had at least 11 years worth of data of a large number of kids getting vaccinated. So you have history on the side effects of that and the problems with that. And so given that, there should be a lot more comfort with giving the flu vaccine, because there's all the studies like with COVID that say it's safe. But with the flu, we also have another 11 years worth of watching it over time to see how it responds. And we've confirmed how safe it is.
Right. And going off of that, kind of still talking about COVID vaccine, are there any updates that you can share regarding kids under 12 and that COVID vaccination?
So you're 24 hours ahead of yourself here. So we know that Pfizer has sent in all their data for kids school age and up, so 5 and older, or 5 to 12. That data has gone in. And tomorrow is the day the CDC said they are going to look at that data and make a recommendation about whether or not they'll offer the emergency utilization authorization. And so we should know more by tomorrow night or maybe by Wednesday.
Okay, great. And where can people check back to make sure they have that most up-to-date info?
I would imagine that it'd be hard not to know. I'm almost positive it'll be on every news channel as soon as they make a decision. But obviously a good source is always, if you're going to get online, is Google the CDC, and they'll have the recommendations right there for you.
Okay, great. And then if your child comes down with some flu symptoms, how should you handle that in this COVID world? Should they go get tested for COVID?
Oh, so yeah. So let me start by saying that's one of our concerns for this year, is that there is a concern that we know for sure that you can get influenza and you can get COVID at the same time. And they're both respiratory infections. And so we're worried how that will compound on top of each other. So there's a growing concern. There was a little bit of overlap between flu and COVID last year. And in adults, they saw worse symptoms in people that had both flu and COVID. But that's as much as I know. And so this year, we're concerned that we can't tell you for sure it's going to be horrible to have both, but it makes a lot of sense to try to protect yourself from both. Secondarily, they're both respiratory type infections, which means nearly every one of the symptoms are exactly the same. So you won't be able to tell if you're not feeling well whether you have the flu or you have COVID or you have both. So it would be my recommendation that if you're testing for one, you should test for both during the winter season.
All right, that makes sense. So this is our last prepared question that I'm just about to ask you, but just want to reiterate that if you have a question in the chat, you should go ahead and put it in now while we're answering this last one. So is there anything else that you would like people to know that we haven't yet gone over regarding flu and kids and COVID?
Yeah, I think there's a lot. I think everybody knows that there's a strong push right now to get the flu vaccine done now. September, October is the time to get it. When you get the flu vaccine, there are 4 different ones that are out there. The Academy of Pediatrics is recommending, the CDC for that matter, is saying there's no difference. Get whatever one your doctor is going to give you. That's all good. There is the injection type and there is the nasal spray type. The nasal spray, there's some contraindications to getting the nasal spray. You should not get the nasal spray one if you're under 2 years old, or if you have asthma. And pregnant people should also not get the nasal spray one. But all the rest of them are what are called quadrivalent, which means they have 4 different types of flus. They're meant to attack 4 different types of flu strains. And so it's a very good vaccine, and getting it's important. Check with your pediatrician, because kids under 8 years old, it gets a little complicated, but many of those kids will require 2 doses to be fully vaccinated, whereas over 8 years old, it's only 1. There's a subset of kids under 8 that may only need 1, but talk to your pediatrician about that as well. And so getting the flu vaccine, I think, is hugely important. I've talked to this group before about getting kids back in school and keeping them in school, how important that is, both academically and socially for kids and for their mental well-being. And the flu vaccine and the COVID vaccine are a strong way to support keeping kids in school during the academic year.
Okay. Well, I just want to say thank you so much. On a personal level, I'm a mom of 2 young girls, so this is motivating me to go make sure we get their flu shot ASAP. So thank you very much. So thank you to Dr. Barsotti for joining us today, and to everyone for listening and sending in your questions. If you're looking for medical advice, please visit providence.org. And make sure to follow us on social media at Providence on Twitter and under Providence Health System on Instagram, Facebook, and LinkedIn. Thanks so much.
Thank you.